Welcome to Faith and Freedom. For the next few minutes, we hope to inform, inspire, and encourage you as we discuss the legal victories and challenges to your fundamental freedoms and religious liberties. Faith and Freedom comes to you from Liberty Counsel, a civil liberties education and legal defense organization. Join us now as Matt Staver, the President and General Counsel of Liberty Counsel, explains the latest legal issues all across this country in the courtrooms of America. Liberty Counsel is winning the battle for your constitutional freedoms.
An important victory for public health. I'm Matt Barber, Director of Cultural Affairs with Liberty Counsel and Associate Dean with Liberty University School of Law, in for Matt Staver today. And joining me in studio is Sean Akers, Dean of Liberty University's Helms School of Government and Policy Analyst with Liberty Counsel. Well, Sean, unbelievably, many on the left, particularly radical activists within the homosexual activist lobby belonging to a number of homosexual pressure groups such as the Human Rights Campaign, the National Gay and Lesbian Task Force, have been pushing very hard to have the FDA's, the Food and Drug Administration's, ban on men who have sex with men or who have ever had sex with another man, gay men, homosexual men, a ban that is still in existence against these individuals giving blood. Now, that ban is not willy-nilly. This is not something that is in place because, the FDA and the Centers for Disease Control and Prevention and others, these are not bastions of conservatism. But they recognize the science here, the scientific reality that men who have sex with men are at an astronomical rate much more likely to suffer from a variety of communicable diseases, sexually transmitted diseases. Now, again, I don't say this to be mean. We don't say this to malign these individuals, but the reality is that unnatural behaviors beget natural consequences. And the natural consequences of many of the high-risk behaviors associated with homosexuality all too often involves disease and oftentimes even death. Sean, listen to some of these statistics. Men who have sex with men are 60 times higher, according to the Food and Drug Administration, 60 times more likely to have HIV/AIDS. They are 800 times more likely to have AIDS than a first-time blood donor, 8,000 times more likely than repeat blood donors. They are 5 to 6 more times likely to have hepatitis. And just as another example, gay men make up somewhere between 1 to 2% of the population, account for 64% of all syphilis cases. That is epidemic. Now modern science, for instance, HIV/AIDS lies dormant for quite a while. There's no possible way to ensure that men who have sex with men donating blood, in fact, the reality is the science shows that blood would become tainted. Yet, in the interest of political correctness and pushing, the left's notion of tolerance and diversity, the Human Rights Campaign, many on the left, even a number of left-wing congressmen and senators, John Kerry being one of them, have been pushing to have this ban lifted because it's discriminatory. This turns logic and reason on its head. Well, thankfully, recently, the Federal Advisory Committee on Blood Safety and Availability, part of Congress, voted 9-6 Friday to maintain current blood donation rules and effectively forbid practicing homosexuals from donating blood. Sean, I can't believe we're even having this conversation, that there's any question, and that it was this close, 9-6 decision to protect the general public from tainted blood. It boggles the mind.
Matt, I know sometimes it's hard to draw a distinction between politics and policy, but this is one of those places that shows the reason that there should be a distinction between politics and policy. The reason that we're having this discussion is because certain folks would like to use a political ideology to make a statement in a policy realm. What I mean is you've got health considerations here, and in the military you've got military considerations, and those are policy. Those are substantive. Those are things that affect our safety and our protection as a society. Now, the political side is a culture war that would like to debate things like whether homosexuality is something that should be endorsed by the state, whether particular social modes should be endorsed by the state. So when you bring those two discussions and you overlap them, when you try to use policy to make a political point, what you do is bypass the science to make your political point, which is exactly what was attempting to be done here. Now, fortunately, the science trumped here, and people aren't going to be placed in danger, at least not right now, through blood transfusions that could possibly be tainted just to make a political point.
Well, and